All right, I think we're ready to go here. So, hi, thank you for coming. My name is Dr. Tara Whiton. I'm the program director for the Health Administration program at the University of Maine at Presque Isle and the assistant professor for the community health concentration. Today, I am going to present to you on food coping strategies during COVID-19 and beyond, specifically in Maine. Here we go. So I like to put a trigger warning out there on some of the topics I present about and lecture about in my classes. It is important to note that many topics in public health have the potential to trigger individuals in different ways based on their past experiences. This presentation does address food insecurity, which, in addition to obvious health implications of nutritional insufficiency and malnutrition, it's also a major source of chronic stress and trauma. If you, your family, or someone you know is struggling with food insecurity, please feel free to reach out to me privately after this presentation, and I can help connect you to some helpful resources. So a little bit about this project I've been working on with a couple of researchers from UMaine Orono. This project is for the National Food Access and COVID Research Team. So it's a national project gathering information about food in relation to the COVID-19 pandemic. If you go to the NFACT website, there's a tab that says research and then a section for policy briefs. If you go there, you'll notice that Maine doesn't have any policy briefings yet. So that's what we've been working on. This research is not published, so I can't share any specific data with you. This presentation is mostly content related, topic related, and I will share some general information, but for now, the data is still secret. So a few topics I'm going to cover in this presentation: food coping strategies, food access, and home food provisioning. So we're still dealing with this initial shock and crisis of the COVID-19 pandemic. That was the initial shocker to sort of initiate a lot of change that we're seeing. COVID-19 has impacted the ways in which Mainers normally engage with and have access to our food systems. Food systems and supply chains were disrupted. We had lockdowns, there were job losses, and that led to loss of income and purchasing power. This resulted in higher rates of household food insecurity. Food security means, at a minimum, there is access by all members at all times to safe, sufficient, and nutritious foods for an active and healthy life. Food security encompasses 4 traditional dimensions. There's food availability, food accessibility, food utilization, and stability. The COVID-19 pandemic has exposed the fragility and resulting resilience of our food systems and its link to people's food and nutrition security. Additionally, research has shown that the threat to food security was not the result of the virus itself, but the income losses that mainly affected the access dimension of people's food security. So we're looking primarily at food access being a major disrupted component of food security because of COVID-19. These findings have highlighted the important observations around food access dimension, in that it is imperative to focus not just on the initial shock of the crisis, but to turn our focus and responses to the different actors that can act on food access, such as policymakers, that together can help mitigate or counteract the initial effect of shock to help build food system resilience and capacity. So as far as food coping strategies, these are implemented when minimum food requirements are not achieved, and households may adopt coping strategies to acquire acceptable foods and maintain food sufficiency and to secure their livelihoods. There's 4 main categories of behaviors of food coping strategies that people adopt when they're faced with insecurity. The first is dietary change. And this can be switching from preferred foods to cheaper, less preferred substitutes. as an example. The second category is to increase short-term household food availability. Some examples of this could be an attempt to increase food supplies using short-term strategies that are not really suitable for a longer period of time. For example, borrowing food, purchasing food on credit or credit cards. More extreme examples are begging or consuming wild foods or seed stocks. The third category of behavior is to decrease the number of people that need to eat in the household. Some examples of this could be sending children to the neighbor's house during meal times, relying on the school system, sending household members to beg for food. And the fourth main category of behavior for a food coping strategy are rationing strategies. And some examples of those could be limiting portion sizes at meal times, restricting consumption by adults in order for the smaller children to eat, reducing the number of meals eaten in a day or skipping a meal or two during the day, and then last but not least, skipping entire days without eating. That's the more extreme example. Food coping strategies are often measured as direct indicators of food insecurity because they are easier to assess than other household analyses of income and food consumption. So here are 4 main categories of food coping strategies. In addition to determining what strategies people are using, we also need to look at the frequency of how often they're utilizing some of these coping strategies. Obviously, not all of these coping strategies are equal in severity, so we need to assess what coping strategies people are using, the severity of the coping strategy or how tough the strategy is, and then the frequency, which is how often the strategy is used. The use of coping strategies in food insecure households can be an indication that things are getting worse and are often not nutritionally sustainable for physical or psychological health. So the purpose and rationale of this policy briefing work was to identify the commonly reported food coping and food access practices of Maine survey respondents before March 2020 compared to August 2020. So we had a really brief time shot right in the beginning of the COVID-19 pandemic. Differences in food coping strategies have been identified between newly food insecure versus consistently food insecure households, indicating a need for proactive strategies to address food insecurity during the COVID-19 crisis and beyond to reduce potential health and safety impacts. And monitoring food coping strategies and therefore food security status and the incidence of hunger is of huge value to future policy and community health programs. So like I said, I can't share specific data, and I'm not going to even share our specific methods for this policy briefing that we're working on, but some very general trends as far as coping strategies. We realize that there is an age influence on what food coping mechanisms are used and how often. Behaviors that we noticed included both financial and food compromisation strategies. The most commonly reported strategy we found were that people were purchasing foods with a longer shelf life and buying less expensive food or different foods than normally purchased items. So people were altering their financial food strategies. There was an increase in the percentage of people who reported using risky food coping strategies since the beginning of the pandemic. For example, eating food that came from dented cans or damaged packaging and eating out-of-date food. Among younger people, and not children, but generally like maybe college age, early adult, there was an increase in eating self-reported spoiled food since the beginning of the pandemic. Also, just to know a couple other general findings, the older respondents were less likely to report risky food coping strategies, likely just due to their education levels. Younger respondents are more likely to accept food from friends and family and borrow money from friends and family compared to those who are older. Professional or more working age adult, and again, I can't give out specific age groups or specific information, but the professional working group more frequently turn to hunting, fishing, gardening, and raising backyard animals for household consumption as coping strategies than older people. In terms of food access, very generally, people worried about food access during COVID-19. There was also an increased, possibly risk perception in obtaining their food. For example, standing too close to people in stores. People worried about the costs of food as well as national supply. And there was a worry about not enough food in the stores because of the pandemic. There was a worry about loss of access to programs that provide food or money for food. And there was difficulty finding kinds of foods that families preferred to eat, finding as much food as they wanted to buy, having to travel more to find their usual goods that they purchased, and generally reducing the number of shopping trips for safety. In terms of home food provisioning, so this is a pretty interesting general finding. We found that more people engaged in home food provisioning techniques either for the first time or more than they usually did in years past. Newer, aka since COVID-19, home provisioners were more likely to be younger. And those who gardened and preserved in the past increased their practices since COVID-19 began. Gardening and preserving were the most frequently used techniques. And that includes, so home provisioning activities include fishing, foraging, gardening, hunting, preserving food at home, and raising backyard livestock. Out of those, gardening and preserving were the most frequently used techniques. Those who did raise backyard livestock reported doing so for the first time since COVID-19. So people are adopting some new behaviors to acquire food sufficiency. So a brief summary here. Mainers responded to the COVID-19 pandemic by altering their behavior around food access, availability, and security. There was a widespread increase in gardening and food preserving to improve food security or serve as an important safety net for health and well-being. We can identify trends in such behavior, identifying trends in such behaviors can provide important educational insight and evidence for future policymaking and food programs surrounding food, food security, nutrition, health, and resiliency of communities responding to crises. A major barrier to household food sourcing and home gardening and provisioning is secure access to suitable land to grow food as well as gardening skills. And then we wanted to raise additional concerns. There was an increase in risky food coping strategies that were adopted. So it seems like there's a lot of opportunities to expand education around food safety. So to summarize, a lot of this information gives us really important information about food behavior around food access, availability, and security. They serve all of these points serve as important resources and educational implications for community health, community food programs, and community gardens. So we have a lot of work to do. This is just the beginning, and hopefully soon you will see our research up as a policy briefing on the NFAC website. If you have any questions, please reach out to me. My email is tara.whiton@maine.edu. Thank you.